Hello everyone. Today I will address a frequently asked question and about which I have already made several videos. The types of brain tumors, their symptoms, and the main differences between them. When we talk about brain tumor, we are basically referring to a location in the brain and an abnormal growth of cells. However, there are dozens of subtypes of brain tumors, and the classification of these subtypes is crucial to determine the severity, the risk of surgery, and the patient's prognosis. Most of the questions I receive on the channel are related to this topic, and I have a playlist dedicated to it where each subtopic is detailed. Today, I will summarize for those who are just arriving and have many questions about this subject. When we talk about brain tumors, the location and symptoms vary greatly. The brain, despite being small, receives a large amount of blood due to its complexity and importance. One of the most classic and important symptoms is cognitive change, which can affect reasoning and thinking. Many patients are concerned about these symptoms because a tumor can alter consciousness and the way of thinking, and surgery can have associated risks. In terms of neuroanatomy, the brain has specific regions for functions such as language, motor skills, and balance. For example, tumors in the left frontal or temporal region can cause language impairment, known as aphasia. Tumors in the motor area can result in weakness or motor impairment. The rate at which the tumor grows also influences the severity of symptoms. The symptoms of brain tumors can be insidious, meaning they can develop slowly and be difficult to detect early on. This can make it difficult to completely remove the tumor. The location and subtype of the tumor are crucial factors in determining treatment and prognosis. Two important symptoms that I haven't mentioned yet are headaches and seizures. Headaches occur because the skull is a closed box, and any increase in volume can cause pressure. Seizures occur because the brain works by electrical circuits, and a tumor can cause an abnormal electrical discharge. Now, let's talk a little about the subtypes of brain tumors. There are benign tumors, such as meningiomas, which generally have a good prognosis, and more aggressive tumors, such as glioblastomas, which are more difficult to treat. Brain metastases, which are tumors that originate in other parts of the body and migrate to the brain, are also common. Meningiomas are tumors that originate in the meninges, the membranes that surround the brain and spinal cord. They are usually benign and grow slowly. Most patients with meningiomas can live a normal life after surgery, although some may need additional treatments, such as radiation therapy, if the tumor is more aggressive. Another common type of brain tumor is a neuronoma, also known as a vestibular schwannoma. This tumor often causes symptoms such as tinnitus and dizziness. It is benign and grows slowly, and treatment may include surgery or radiation therapy to resolve the problem. Pituitary adenomas are tumors that originate in the pituitary gland, located at the base of the brain. They are usually benign and grow slowly. Treatment is usually surgical, and surgery can be performed through the nose, a technique known as transsphenoidal surgery. Patients usually need to be monitored by a neuroendocrinologist to monitor possible hormonal changes, but quality of life can be good after treatment. In addition to benign tumors, there are more aggressive and malignant brain tumors. Glioblastoma multiforme is an example of a malignant tumor that originates from glial cells, which are the supporting cells in the central nervous system. This type of tumor is very aggressive and difficult to treat. Treatment usually includes surgery, radiation therapy, and chemotherapy, and the prognosis can vary depending on the location and size of the tumor. Brain metastases are tumors that originate in other parts of the body and migrate to the brain. They are common in patients with breast, prostate, and lung cancer. Treatment may include surgery, radiation therapy, and chemotherapy, depending on the origin of the primary tumor and the location of the metastases in the brain. It is important to note that although many brain tumors can be successfully treated, we do not yet have a definitive cure for all types of brain tumors. Medicine has advanced significantly in recent years, and new therapies are being developed to improve treatment and quality of life for patients. In summary, the classification and subtype of brain tumors are essential in determining treatment and prognosis. I hope this has helped shed some light on this complex topic. If you'd like more information on a specific type of tumor, be sure to check out the playlist on the channel. Thanks for following along, and if you have any further questions, feel free to ask.